Now, LevMed, in partnership with Uganda Heart Institute, Uganda Alliance of Patient Organizations, have introduced a mobile ECG toolkit in East Africa that will help improve access for patients' diagnosis. I'm joined by Violet Namata from the Heart Institute. A very good afternoon. Kindly explain to us or help our viewers understand how important is it
well,
for having
the ECG tool
ECG
has been introduced here in Africa. It is making its first entry. But to understand what ECG is, we need to first understand that an ECG is a simple test that can be used to check your heart's rhythm and electrical activity. So the mobile ECG tool that has been introduced by the LevMed company is going to help actually many of the heart patients to be able to diagnose heart problems easily. So it is making its first entry again in Africa, and it has been done in Chitovu Hospital. And the findings show that in Chitovu Hospital now people can easily be diagnosed. 60 people can easily be diagnosed in a day, and so heart problems can easily be solved compared to the traditional one that we had that required you to pay actually 200,000 shillings to make a full diagnosis of a heart problem. So now patients are actually paying only 4,000 shillings for you to have the full heart diagnosis. So that means that this mobile app or the mobile ECG is making life simple, and it can be used anywhere. And it can be used in whichever hospital. It could be a big hospital, it could be a simple health center, meaning that anyone can use the ECG, the mobile ECG that has been introduced here in Africa. It has been in existence for 10 years, and it has been present in Israel, the whole of Europe. So it is going to help most of the East Africans to actually solve these heart problems. So we've had very many people that are suffering from heart problems, and over the world, very many people have been suffering from heart problems. But this time round, if we have only 60 people diagnosed in a day, then that means that very many people will be able to get treatment of heart issues. So the ECG, the mobile ECG, will be very helpful to the bigger population, most especially in rural areas.
Thank you so much, Violet Namata, for that particular report.